Now, coming to question number 2, a 8-year-old child presents with patchy alopecia over the scalp. What treatment would you advise? Okay, so the word patchy alopecia here brings us to the answer being either alopecia areata, Trichotillomania, or Tinea capitis, right? So we are using the knowledge from the previous question also here. So it could be any of these three. Now, when it is a child, I have told you many times across different discussions, whenever the question mentions a child with patchy alopecia, your antenna should be rising for Tinea capitis. That should happen. Chiller party, remember the movie Chiller Party with children in it, that is what is Tinea capitis. Now, let us look at the image, what the image is showing us. There is a patch of alopecia, and in this patch, you see multiple black dots. So, a child with a patchy alopecia showing multiple black dots. Where do you think this is going? This is again clinically also going in favor of Tinea capitis. So the text in the question that it's a child with patchy alopecia narrowed us to 3 options. Black dots in the image took us to Tinea capitis. So according to us, according to the image here, the diagnosis is black dot type of Tinea capitis. What treatment would you advise? Minoxidil lotion, not required. Tablet Griseofulvin, definitely it's an antifungal. It can be considered. Cognitive behavior therapy would have been the treatment had the answer been trichotillomania. Intralesional injection triamcinolone would have been the answer had this been alopecia areata. So the correct answer here is option C, that is tablet Griseofulvin, because this girl is suffering from what we call as black dot Tinea capitis. Remember, black dot, the mnemonic is BNT. You see this patch of alopecia with multiple black dots in it. The type of hair involvement is endothrix, and the fungus that causes it is Trichophyton species. Trichophyton tongerans, Trichophyton violacum. These are the 2 common ones that cause it. So you see the black dots here. You have to basically differentiate this from alopecia areata. In alopecia areata, the skin inside the patch is smooth and bald, while here you see a lot of black dots. So it is these black dots that help you go in favor of Tinea capitis. Had this been covered with a lot of gray colored scaling, this would have been gray patch Tinea capitis. Remember the mnemonic GMC here, gray scaling over it, caused by the microsporum species. C is for the ectothrix. That is, the spores will be seen on outer surface of the hair shaft. So GMC, BNT, these are the 2 non-inflammatory Tinea capitis. Coming to the inflammatory Tinea capitis, we have Favus, which is a rare type of Tinea capitis caused by a specific fungus, which you need to remember. That specific fungus that we need to remember is Trichophyton Schonloni. So remember the word Trichophyton Schonloni with Favus and the C-shaped crust that are called as scutula. Carrion, again seen in children who may be having history of keeping pets, as a red boggy swelling covered with pustules, mildly painful. Regional lymphadenopathy may be seen. That is a carrion. So remember, it is mildly painful despite all the erythema, pustules, and the swelling. This is how you differentiate it from pyodermas, that it is mildly painful. All fungal infections, how much soever ulceration you see, inflammation, swelling, like in the subcutaneous mycosis, the mycetomas, sporotrichosis, carrion, despite all the inflammation that you see, all these fungal infections are painless. Next investigation here would be a KOH scraping where you see hyphae. So remember, this question can be framed in a different way. What is the next investigation? That could be KOH. Where is wood slam positive seen? Wood slam positive is seen in the gray patch Tinea capitis where the color becomes pale green fluorescence. Treatment of choice, only oral antifungals, that is Griseofulvin, given at a dose of 10 to 15 mg per kg per day. Now, in Griseofulvin also, this is like an advanced question. We have micronized as well as ultra micronized formulations. See, with Griseofulvin, there are two formulations, micronized and ultra micronized. Ultra micronized goes 15 to 20 mg per kg per day. Okay, so just remember this dose, 15 to 20 mg per kg per day. Now, coming to the point of how to differentiate the patchy alopecias from each other, remember, alopecia areata is chickney chameli. The skin in the patch is completely smooth and clean. You see a bald skin as if there was never any hair in it. So this is like absolutely clean look. That is chickney chameli. This is the finding that we see. What is this? Yes, tell me, what is this? This is the exclamation mark here, which we see in alopecia areata. Very, very important image, has been asked multiple times in the FMG exam. Then we have trichotillomania, where the patient is pulling out their own hair. It is an obsessive compulsive type of disorder, irregular, bizarre shaped lesion with broken hair of different lengths, very follicular hemorrhages. Sometimes the patient can eat the own hair, which is called as trichophagia. The hair is not digested in the GIT. Over time, it can form a stone-like concretion that is called as trichobasoar. So remember, a complication of trichotillomania can be trichobasoar. When you see it closely, you see these broken hair. That's a dirty picture as compared to alopecia areata. So in alopecia areata, it was chickney chameli. In trichotillomania, it is a dirty picture. Treatment with cognitive behavior therapy, drug of choice, SSRIs. Tinea capitis, we have already discussed. Remember, chiller party, child with partial alopecia, itching may be present, and you see these black dots. Mainly, you have to differentiate between these three in the exam.